We have a series of reports tonight on how the vaccine is rippling across American life. Marky Martin is at one college where students are coming back to school. But let's begin with Rudabeh Shabazi as a grad student defends his operation of a vaccine clinic in one of America's largest cities. Rudabeh, what happened?
Morning, when Philadelphia began getting its first batches of COVID-19 vaccines, the city looked to a partner with someone who could get mass vaccination sites up and running quickly. And they chose a 22-year-old graduate student in psychology with a few faltering startups on his resume.
I did absolutely nothing wrong. I regret nothing. And if anything, I did above and beyond at what everybody expected.
Philadelphia's health commissioner says when the vaccine was rolled out, hospitals were busy vaccinating their own staff. So the city partnered with Philly Fighting COVID, a startup run by 22-year-old Andre Dorshan, who had organized one of the community groups that set up COVID-19 testing sites throughout the city last year.
So we had that history with them for the testing services. They had what looked like a good plan. We looked and saw we had staff there at the initial site, and the vaccination worked well. We got 2,500 people vaccinated in 2 days, and so it looked at that time like this was a success. This other information came to light subsequently.
That other information led the city to shutter the operation last week, once officials learned that Dorshan had switched his privacy notice to potentially sell patient data, a development he calls a glitch that he quickly fixed.
This was a baseless concern that was raised as a reason to remove us from the operation. This concern is baseless because this is HIPAA data. It's identifiable medical data, which is a federal crime to sell. We are, scientists and engineers. We know the rules about medical data.
Dorshan also conceded that he took home 4 doses of the Pfizer vaccine and administered it to friends, although he is neither a nurse or a licensed healthcare practitioner.
On Saturday, we had to turn away 3,000 people who were not healthcare workers from the clinic because the health department had a very strict prioritization rule that we're only allowed to vaccinate healthcare workers. At the end of the day, we had 100 syringes left of vaccine that was going to expire within hours, and it was reconstituted, and the directive from the health department was find an arm and put it in, regardless of the prioritization. So at 6:30 that day, we called healthcare workers, we called elderly, we called everybody, and we got 96 people vaccinated. At 9 o'clock, they were about to expire. I ran home and I vaccinated 4 of my friends. This was done recording the data with the CDC and the state. I had done all contraindications pre-evaluation. I had epinephrine on hand. I have experience doing intramuscular injections, and I do not regret this decision. It was the ethical one to make because those vaccines would have gone in the trash.
If that's true, that's very disturbing. They shouldn't do that. As you know, we've stopped our relationship with this organization, but we're going to try to do what we can to find out if there were any missing doses. And as I said, we will not be working with that organization in the future.
In a letter, the city's mayor directed the health commissioner to hold clinics to ensure that everyone who received a first dose of the vaccine gets their second dose from professionals on time. He also ordered that the remaining vaccine doses be allocated to other organizations, and he asked for a public report within 30 days detailing the relationship between the city and Philly Fighting COVID.